So this segment of the program is going to be on traditional healing practices and the end-of-life care, with the first speaker being our own, Dr. Kakik. He's a Wallace Annenberg professor in Integrative East-West Medicine, founder and director of the UCLA Center for East-West Medicine, and a real pioneer of bringing the wisdom of ancient healing practices from Chinese healing practices to the mainstream medicine academic center. And so he's lived through all the upheavals and challenges of doing work like this in the mainstream medicine that was not receptive initially and now is increasingly receptive. He'll be followed by a workshop provided by Yuan Miao, who will grace us with her presence, and her crew is setting up other things that she's going to use. But let me welcome Dr. Huey first.
Good afternoon. Thank you so much, Helen, for inviting me to speak at this conference. And I came today to learn a lot from this morning's presentations. And yesterday I was going to come, but I have to take care of my 96-year-old mother. And obviously she has been declining, but I think she's still going strong and being loved. And so since I only get about half an hour to summarize my 40-some years of work, I'm at UCLA 50 years and class of 1975 medical school. So what I'm trying to do is to kind of share with you what I talk about at the American Society of Clinical Oncology meeting last April in terms of integrative oncology care. And so when I first started, as an undergraduate chemistry, I was really looking at Western medicine, just finding a new drug from the herbal pharmacopoeia, just like what the previous speaker focused on herbal medicine. But in 1971, I was exposed to the use of acupuncture during surgery, and then I found out that China has been embarking on integrating Chinese and Western medicine since 1955. So that was my dream back in 1971, that I would use UCLA as a platform for me to try to understand how the West approach health and disease, what are its strengths and weaknesses, and at the same time trying to understand how Chinese medicine for millennium has approached health and disease, and the work that the physicians in China, the investigators in China have been trying to put the two together. So that's sort of how I kind of, as I go through UCLA Med School, I compare both the Western model in general is more of a linear acute crisis care model, compared with the Eastern model, which in general is much more looking at the system. And by virtue of understanding both and putting the two together, back in 1993, I'd established the Center for East-West Medicine. The main thinking that I have is that we need to put the patient back together. And that was kind of very interesting, that I wrote about this for the WHO back in year 2000 and even a lot earlier in the 1990s. But I'm glad that the New England Journal of Medicine, with this viewpoint article by the chairman of medicine at the Brigham, talking about putting the patient back together, social medicine, network medicine, and the limits of reductionism. So obviously, and in the last several months, since I spoke at ASCO, and I'm becoming acutely concerned about what is going to happen to every family who are going to be facing their elderly parents with cancer. The cost of cancer care is so expensive nowadays, it would bankrupt every family, every country. And that, so I just want to share with you what I've been just talking about the last several months, in different countries and different cities. So this is integrative oncology definition. talking about a patient-centered, evidence-informed field of cancer care that utilize mind and body practices, natural products, and lifestyle modifications from different traditions along with conventional cancer treatment. Now let's talk about when we're going to apply this model, because oftentimes people start out with after failing conventional medicine and then they add a little bit of whatever may work to now a little bit of some of these approaches being used during the course of patients' cancer care. So obviously, I don't need to belabor, mind-body modalities, which has been really covered extensively, and I think massage is a very, very underutilized approach that I think, if you know how to do it, it can really help, sort of in the palliative care, period. But obviously, in our extensive clinic system, we have 5 clinic sites within UCLA health system with a lot of patients being taught how to do self-massage with tennis ball, golf ball, with sort of the family or self-massage. Because I think it's very important for people to understand that massage is an underutilized approach, for symptom control. And now I don't have time to talk about Chinese herbal medicine. Obviously, in China, this is what I'm working, on, is to try to sort of let people recognize that a lot of the use of Chinese herbal medicine even in different type of care, including oncology care. But again, in this country, most oncologists would not like to have, obviously, Chinese herbal medicine being used during the course of cancer treatment. I will say a few words about acupuncture-like, type of approach. And then, obviously, we've been looking into dietary interventions, not so much in terms of sort of the average diet, but a personalized diet according to the person's constitution and also their pattern. Now, when I first started the center in 1993, I already recognized that we should not be using narcotics in treating non-cancer pain. I think even with cancer pain, if it's like related to soft tissue problems from radiation, from surgery, from chemotherapy, you don't need to use narcotics. Okay, but I mean it's eroding, sort of cancer in nerves and bones and so on. Then obviously you may need to use narcotics. So that's why in our clinic approach, we use acupuncture, we use massage, we use trigger point injections. We teach people how to do a lot of things that they can sort of help decrease their pain. So right now we are facing a opiate crisis. Obviously, there's a chronic pain crisis because doctors are not going to use narcotics, and when you use steroids and use NSAIDs and even some of the pain adjuvants, it's still problematic. So in this country, there are about 70 some health systems and medical schools that have integrative medicine, and that so. There's a white paper that was put together that I think would be good for you to be aware of. There's a lot of non-pharmacological approaches to help patients with pain. And so now Tai Chi, obviously, it's been covered already, right? And hypnosis, music therapy, mindfulness meditation, and I think that I don't need to belabor that. And obviously, not only would it be very helpful for pain, but also for anxiety, for insomnia, and also for even nausea and vomiting. And that, so we talk about massage therapy. Now let's talk about acupuncture, something that I think people think that acupuncture is only for pain, but basically acupuncture can be used adjunctively for many conditions. We have 31,000 patient visits coming through our 5 clinic sites, and we are able to add acupuncture-like stimulation. It doesn't need to require needles. Okay, so obviously the majority of the research data is on using the body acupuncture, or now obviously the ear acupuncture that they use, for the medics in the battlefield. So for pain, it can be used for fatigue, for hot flashes, and nausea, vomiting, and also for dry mouth. And so the important thing that I think most people concerned about is that with acupuncture, I'm scared about needles. But for most of our patients, because we are such a backlog of people waiting to get in, we ration our clinic visits. So we teach them how to use sort of TENS unit to stimulate the acupuncture points, so that they are able to come like maybe every 2 to 3 weeks, because it's difficult for us to absorb more than 500 physicians within UCLA who refer to us. So obviously nausea, vomiting, not just for chemotherapy, but we use it for people with pregnancy and so on and so forth. But dry mouth, a lot of radiation. Patients with radiation, they have a lot of dry mouth. And obviously the neuropathy. We see a lot of the patients with chemo-based neuropathy. And obviously when people get the diagnosis of cancer, they are all very anxious, they have insomnia, they're depressed. So the beauty about acupuncture is very safe. The malpractice insurance for acupuncturists is less than $1,000. Okay, so it's sort of something that one can actually use, and if you get around the fear of needles, which I think you can use other ways to stimulate. Cupping is a form of acupuncture-like points, stimulation. So Michael Phelps was a great, promoter for cupping, during the Olympics. So we specifically, and I think that for many of you who are health professionals, you are all going to be stressed, with many of the patients. It will be good to just learn how to stimulate a point in your second metacarpal, which you can massage yourself when you have a difficult situation with patients that are, obviously challenging. And that the research was done, at Mass General back in 1999, year 2000, to just, when acupuncture stimulates this point, it modulates the limbic system, and it's basically allow you to have decreased stress. So another corresponding point, not this point here, but in your big toe and the second toe, 2 fingers from the web, this is another point which is very common in many of you. Okay, if you can just learn how to massage it and teach your patients how to do it, you would decrease pain, you can decrease anxiety and stress, and that. So again, this was done, by the Mass General group. So in terms of a lot of patients with pain, but also many symptoms, you can find out that many of the problems related to trigger points. Now, many patients have fibromyalgia, and many of them have chronic myofascial pain. So these would be related to people who have been under a lot of stress. They have gone through a lot of surgery. They've been in the hospital. They've been getting, instrumented many times, and they have accidents of different types. So there are a lot of trigger points in the body. I guarantee you that many of you have many trigger points in your neck, in your shoulder, in your low back. And those are the areas that many patients may complain of pain, and it will not show up in MRIs and X-rays. You have to use your hand to locate it, and then by massaging it, by using either a needle or something else to stimulate the point and make it go away. So because many of the factors externally, but also internally, would lead to sort of this type of trigger points and tender points. When you don't sleep well, you know that your neck is tight, or your neck is tight, you don't sleep well, and then your back, because the neck and the back are stress organs, and if you basically do not watch your posture, and you're under intense stress, or you are driving back and forth on 405 and 101, all these knots are going to start. I can imagine a patient who is sick and worried about dying. So oftentimes by virtue of just touching the patient massaging, some of their, tender points, and many of them actually will enjoy you massaging their neck, their shoulder, or also their feet. So, as I said before, acupuncture is relatively safe, and studies done in Germany and England, demonstrate very, very rare complications. But as I said before, a lot of our patients, we just teach them, go online, buy a TENS unit, which used to be $200-$300. Now is like $30-$40. So you can get a TENS unit, and you just need to be taught how to put in the various acupuncture points. But obviously, in the old days, the physical therapists put it on the tender points or painful areas. So, if you are interested to go to look into the sort of the data about some of these type of approaches in palliative care of cancer, the Chinese University of Hong Kong have put together, a paper back in 2015, and for those who would really like to know more about it, and just I think earlier this year, the Hong Kong Baptist University put together a Chinese medicine clinical practice guideline for cancer palliative care. Obviously, this guideline actually includes Chinese herbal medicine as well. But there's actually guideline in China that talk about using Chinese herbal medicine to treat different types of cancer as well. But again, in this country, we are not really advocating it. We are only at the level of using some of the non-pharmacological approaches to help people going through their cancer journey. And I was talking about our presentation at using integrative oncology and palliative care in supporting patients now, not just people with breast cancer, but now with lung cancer, that these patients are living a lot longer. How are we going to think about having a whole different supportive system? But I'm carrying this to a different level. I don't think it's just supportive. I think that for every patient, at a time of their diagnosis, it will be important to have an assessment by the relevant team, not just the oncologic team. I think that it requires a team approach to look at how best to manage a patient from that point onwards. Okay, because right now this is more or less hit and miss, and but obviously in China they have built integrative oncology for like 40 years, so they have a lot more data. But in this country, obviously, we are still at a supportive role. So one thing that I have been trying to emphasize is that we need to really look at the patient, not just the cancer, the patient with the cancer, and there are many, many problems. So you need to use a system of care to care for that person, and and it should really be thinking about, for people who are high risk, how do you prevent? So this model actually is now what I'm proposing, is to bring it into the new redesigned primary care. Okay, I don't have time to talk about this, but I'm putting this together to try to think about, you just cannot really have the current system to care for patients who have cancer, and that would cost so much money, for 1 year of treatment, and then without really seriously thinking about how best to help people go through this journey, and that it does require a system, because I think there's a system to care for patients with transplantation. But now the amount of money spent for caring for a patient with cancer is reaching the amount of money, because it costs $1 million to care for a liver transplant patient at UCLA. Okay, so I think it's very important that now with the cancer care that we need to begin to think about how do you utilize resources. We need to kind of look at the biopsychosocial, the financial, the ecological, and the spiritual aspect of it, and then allow the patients to select the treatment plan based on individual values, beliefs, and also based on available evidence. And so the idea about palliation is really should be used throughout, the disease process. So I was just listening this morning about successful aging. I mean, I was trained, not just in internal medicine, but also in geriatrics. I kind of look at the idea about successful aging. And I think that we always think about aging, the old age. To me, successful aging can be started very early. Nowadays should be even, hopefully, your parents, to give you, the best genetic endowment, before you were born. So aging. And then the idea about, and I talk to a lot of my patients who are elderly, that, think about not material sort of, but also think about the spiritual. Spiritual longevity is really what I think, that I am, trying to talk about successful aging. Because over the years, as a physician, I see many people who are not, healthy from body and mind and spirit, and they don't have harmonious relationships, but they chase after fame, power, and money. Okay, so basically, I think that it's much more important for us to really think about what really is a successful aging for each one of us before we close our eyes. So that's sort of what I've been thinking about in terms of the idea of successful aging, and the last slide that I want to talk about is music therapy in palliative care. I think music is really very, very important. It transcends all cultures, and this is a very good paper that just came out to summarize a lot of the studies of using music therapy in palliative care. And I hope that many of you have enjoyed the concert yesterday, last night, and I actually turned the CD of Yuan Mao, our next speaker, as I drive, to work, every day. So I think you gave me half an hour. I think I finished in time. I wanted to save some time for questions. Okay? Thank you. Yeah.
For those of us that are not in cancer research or really don't have access to what is going on inside cancer research, what are the insiders are saying? What do you hear from the insiders talking about cancer treatment in a holistic way?
Who's insider?
Well, it depends on what.
People that are actually working on a system of care.
Re- Researchers or the providers of care?
Scientists, doctors.
What are they saying?
What are they thinking about? What is he hearing about alternatives?
He's reading papers.
I think UCLA actually has the SIMSPAN Center for Integrative Oncology that I think they are doing a lot of very good psychosocial support with other areas. But I think that the many different universities like Sloan Kettering, they are also trying to look at how to do better care for patients with cancer. So I gave a talk several years ago and kind of talk about that every intervention that we do as physicians or health professionals, you have to look at 4 scenarios that you improve the quality of life and you improve the quantity of life. That would be the best. But sometimes if we don't make the right decision, it could decrease the quality of life and the quantity of life. And I would say that the quality of life includes what they call now financial toxicity. Okay? And then it will be the other 2 would be some people may go for increase in quantity of life at the expense of quality of life. But other people would basically like to have improved quality of life, even though I made my life maybe shorten a little bit. So that's the reason why I think it's very important for us to really have that very good discussion very early, because a lot of people, once they have cancer, they just focus to find the very best, cancer treatment, versus really thinking about all the issues that I think.
So there's a huge underground. It's not so much underground anymore, but basically a movement of patients who are diagnosed with cancer who are entirely against mainstream medicine. So they would not resort to any approved treatments that we use here, and they would use diet or acupuncture or herbal medicine or anything other than just especially chemotherapy or radiation. They would maybe go through surgery, but not that. Those of us who work in the academic institution, of course, try to integrate it as much as possible. What the institution allows us to use is evidence-based approaches that have some kind of literature and research done on those approaches. Yes, we do have Semel Center, and they do provide a limited number of integrative medicine approaches, music therapy, psychotherapy, but also what needs to happen is some integration with patients' belief system and spirituality. And that is not well done in a center like this. But there are other places that would work with individual spirituality and preferences, basically.
Yeah.
Dr. Yui, thank you very much for your presentation. Where are the 12 centers that you're talking about?
Oh, there are 70-some centers. I think all the UCs except for UC Davis, Stanford, Harvard, Johns Hopkins, Mayo Clinic, and so obviously Sloan Kettering and some health systems also are represented. So they are all over the place. 72 centers.
Consortium.
There's a consortium for integrative
Academic
health and
academic
medicine.
centers.
Yeah.
Okay.
You had mentioned pressure points on the body for dealing with pain or nausea. Could you share a couple more that I could take home, share with my patients?
Okay, obviously, I teach all our patients and our students at least 5 acupuncture points, right? The one, I think if you are interested, go to our center website, Center for East-West Medicine. So this one that I told you about, LI4, is very good for stress. And you can just, rather than a point, you just massage the whole second metacarpal. And if you massage it and you find your muscle is smooth, then you're fine. If you find that it's a little lumpy and it's sensitive, that means you're under stress. So that's one simple point that you can always do for yourself. And you can teach your patients or clients who are not pregnant, because we also use the point to induce labor as well. So another one would be, it's like at the wrist, like between the 2 tendons. This is called PC6. A lot of research has been done for nausea and vomiting. We use it to use for chemotherapy. So this is a very useful point for nausea and vomiting. And another one is, I have to come out here to show you that is a point on the lateral side. When you cock up your ankle, you will feel this muscle there. That muscle, the point is called, you can walk 3 miles. So it's very good for fatigue, but also very good for nausea, vomiting. Those are the P6, and also some of 36 are used for some of the clinical trials for nausea, vomiting. And then another point that we also teach our patients would be the inside, 4 fingers from your medial malleolus. This point is really good for the pelvic. So this one is for the head. This one is above the diaphragm. This one is for the middle, and then this one is for the pelvic. Okay, and then the other one that I show you between the big toe and second toe, 2 fingers from the web, is for anger, emotion, depression, anxiety. That's a very useful point. So those are the 5 points that we have been teaching a lot about patients and but we teach them a lot more. Each time they come, we teach them more how they can care for themselves.
I think you also have a
Yeah, the website. We can go to our website.
And they have a webinar that shows massage, self-massage.
Yeah.
Okay. We
Okay.
Thank you very much.
Thank you.